তো কালকে আবার করবো না।
Start.
Hello, this is Dr. Trivedi, a doctor working in this clinic. May I confirm your name and age, please?
Hello, doctor. My name is Van Diesel and I am 32 years.
Okay, how may I address you?
Please call me Diesel.
Okay, Mr. Diesel. Today I'm going to discuss about your health issues. Is that okay with you?
Okay, doctor.
Okay, and during our discussion, I might take down some notes which will be strictly confidential. Is it all right?
Okay, doctor. I have no problem.
Okay, now, Mr. Diesel, can you please tell me what have brought you here today?
Doctor, for the last 3 months, I have experienced this quite a few episodes that suddenly I developed some racing in my heart, and it usually persists for a few minutes. Then it's go away on its own. And when it comes, I feel that my heart is beating than the more than usual, and it worried me sometimes. And also, for our last few episodes, I noticed that I feel somewhat dizzy during that period. So I became very worried, and after that, I visited my GP. He did an ECG of my heart, but that didn't find anything abnormal. And he gave me some medication for anxiety, and he thought that it will help me, but it didn't help me. So he sent me here.
Okay. I will try my level best to find out what's troubling you. You told that it started around 3 months back. Well, may I know that before these 3 months, have you ever faced this type of problems in your life ever?
No,
Okay. And 3 months back when it started, may I know that did you experience any raised temperature or any runny nose or any other infection?
no,
Okay, that's all right. And you told that it started 3 months back. Well, has the episodes been all the same during these 3 months, or have you been facing this more frequently nowadays?
more frequently nowadays.
More frequently, okay. And you told that once it starts, it persists for 1 or 2 minutes, then it goes away. Am I right?
Not 1 or 2 minutes, sometimes 5 or 10 minutes.
Sometimes 5 or 10 minutes. Okay. Has it been all the same for the last 3 months, or previously was it shorter? Now it's longer periods
Now it's longer.
that it persists. It's longer.
Yes.
Okay. And have you ever noticed that there is any specific time of the day or of the week when it's more or less?
No, it comes suddenly and goes also suddenly.
Goes out suddenly. Anything that you that feels you make better, like
No,
taking a deep breath or
no,
something like that?
no,
Okay. Anything makes it worse?
no.
Okay. Can you please tell me that do you feel that this beating is regular or irregular?
Regular, doctor.
Regular. Okay. And have you ever counted your beats in minutes? How
No,
many beats in minute?
no, but it
Okay.
seems that it is going so fast.
Very fast. Okay. I'm very sorry to hear. And have you ever felt any pounding in your necks?
No,
Okay. Have you ever noticed that you have to get up at night for doing your water work during these episodes of heartbeat?
no.
Okay. And may I ask you some other questions now? That do you have any chest pain?
For last episodes, I developed little bit discomfort, not just this pain.
Chest discomfort. Okay. And any shortness of breath?
Yes, doctor.
For how long?
When it persists for quite a few minutes, then I feel a little bit shortness of breath. That
Okay.
is somewhat like
And
catching breath.
sorry,
Somewhat like catching the breath.
catching the breath.
Yes.
Okay. Okay. And have you ever noticed that when does it get worse or better? Have you noticed anything? This
No,
shortness of breath.
no,
Okay. And do you have to use extra pillows at night to be more comfortable? Have you noticed anything?
no,
Any leg swelling? Have you noticed?
no,
Okay. Any chest tightness or noisy chest?
no,
Okay. Any cough? Have you noticed?
no,
Okay. And now I'm going to ask you some more questions. Do you have any headache?
Yes, doctor.
Okay. When does it come, this headache? Is it always present or does it come and go?
This is not a new thing, but recently it is increasing more frequently.
Okay, you told it's not a new thing. When did it first occur?
It is for about 15 years. I had migraine, and for that I took paracetamol. But recently, I noticed that this is coming so frequently, and when I feel the racing and pacing of my heart, then at that time I feel more headache.
More headache. Okay. And okay, I can get it. And is it in any parts of the head or of the whole head?
Whole head.
Okay. For how long does it persist usually?
Maybe for half an hour.
Okay, I am very sorry to hear. And do you have any at those moments? Do you feel that there is any flushing of your hair, face or something like that?
No,
That's all right. And do you have any problems in your vision?
no,
Okay. And any rashes in any parts of your body?
no,
Okay. Any joint pain?
no,
Okay. Any soreness in your mouth or any parts of your body?
no,
Any weakness in any parts of your body?
no,
Okay. Any difficulty in your speech or swallowing?
no,
Okay. Do you have any raised temperature?
no.
Any changes in your weight?
I think that I have lost a few kg weight, but I didn't measure it.
Okay. Have your clothes are your clothes getting looser?
Yes,
Okay, that's all right. Is it intentional or unintentional? Your weight
unintentional.
loss? Okay, I can get it. Any night sweats?
No,
Okay. And any lumps and bumps anywhere in your body?
no,
Any weather preference?
no.
Okay. And what about your water work? Is it all the same?
I think same.
Same. Okay. Any blood anywhere, anytime in your water work?
No,
Okay. Any frothiness?
no.
Okay. What about your bowel movements?
I think it is normal.
It's normal. No blood anytime? Any blood anytime?
No.
Okay. And may I, at this moment, ask you that do you have any long-term disease condition that you would like to mention?
Not long term, doctor. About 5 years ago, I needed surgery of my neck gland, and after that, I was given some medication called thyroxine. I am taking that.
Okay. Okay. You have been taking that. That's all right. And okay. And have you recently measured your neck gland, some blood test with your neck gland? How is it going on?
No,
You keep regular monitoring? Okay. That's not a big deal, please. Okay. And apart from thyroxine, do you take any other medication?
for headache, I take some paracetamol.
Okay. Any over-the-counter medication?
No,
Any allergy to any medication?
no,
Okay. And any may I ask you? That's a personal question. Have you ever taken any medication through your blood channels?
no,
Okay. And do you have anyone in your family having similar type of condition?
no similar condition.
Okay. Any problems of neck gland in your family running in your families?
Yes, doctor. One of my aunt needed a surgery for cancer in his neck, in her neck.
Okay. What about your? May I know what about your father and mother? Are they all right?
I think they are.
Okay, that's all right. And your siblings?
I am the only child.
Okay, that's all right. That's all right. I'm sorry to ask. And okay, and okay, just let's come back to you again once again. Do you have any problem with your blood pressure level or blood glucose level? Do you know of any?
No, I don't know.
Okay, and may I ask you some personal questions at this moment?
Okay.
Do you smoke?
Yes.
How many sticks for how long?
About a pack each day for last 10 years.
Okay, actually, smoking is very harmful for your health, and it would be wiser if you stop smoking. And if you want, we can refer you to smoking cessation clinic. Will it be all right?
Okay.
Okay. And do you drink alcohol?
No.
Okay, that's very good. And may I ask you that what do you do for a living?
Be a sportsman.
Okay. And may I ask you a very personal question at this moment?
Okay.
Okay. Do you have to take any medication for performing better in your sports?
No.
Okay, that's all right. I'm very sorry to ask. And okay, and may I ask you that have you had any recent travel history to any countries?
No.
Okay, and okay, and may I ask you some more personal questions at this moment?
Okay.
Okay, may I know whom do you live with?
Living with my wife.
Okay, and uh, okay. Mhm. And may I ask you something more about your personal habits? Actually, that do you have you been under any stress recently
No.
in your personal life?
No.
Okay, and do you drink tea or coffee?
No.
Okay, that's all right. And okay, and okay. When may I ask you just again that when you feel these type of problems, do you feel any type of sweating in your body?
Yes, doctor.
Okay. And does it persist for the same time as long as this racing and pacing of your heart continues?
Yes. 2 minutes remaining.
Okay, okay. And do you feel that okay? Okay, so now at this moment, I would like to know what your concerns are.
Why am having this, doctor? Is it like a heart
Okay,
attack?
okay. At this moment, actually, I will have to examine you thoroughly and also do some tests. Okay, but as long as I have taken history, I will let me ask you another question. That when you told that you have the racing and pacing of your heart, did you ever feel any hunger?
No.
Okay, that's all. As long as I've taken history from you, I think that it's a condition named pheochromocytoma. Have you ever heard of it?
No.
Okay, it's actually, I think it's a case of pheochromocytoma associated with Menn syndrome. So please don't bother about the term. It's a condition in which there is some excess chemicals, okay, produced in the body, and these chemicals can cause the symptoms that you are having, okay, your blood pressure level, and also sometimes that a headache or sweating that you are facing, okay. However, we have to be sure about it by doing the blood tests, and we will also involve the heart doctor and the medicine doctor in it. Okay, they will diagnose it at first and also uh, give you a proper planning. Okay, and at this moment, just may I ask you that do you drive?
Yes.
Okay, and it would be better as long as we make a correct, proper diagnosis. Just stop driving, okay? So that it doesn't cause any harm to you or anybody else. Will that be okay for you?
Okay.
Okay. Do you have any more concerns?
Will I need any other surgery again?
Well, actually, there might be a surgery, okay, and but at the beginning we will have to
Time up.
diagnose it properly. Okay.
Okay. Have you reached your diagnosis?
Well, I think the patient is suffering from pheochromocytoma associated with Menn syndrome.
What are the points in favor of pheochromocytoma?
I think the patient has a headache, uh, also sweating, and he has got racing and pacing of his heart now.
Did you ask about any history of abdominal pain?
Oh no.
Any other differential do you have?
Uh, well, differentials here in this patient.
How will you investigate this case?
Well, you told about the differentials. I think it can be a case of pheochromocytoma and also uh, other differentials. It can be. I'm not sure, but there are very less risk factors for others at this moment. So I'm not sure what other causes can be present in this patient.
Can it be associated with thyroxine induced?
Oh yeah, it can be, but yes, it can be present with thyroxine induced.
And any other causes of palpitations like structural heart abnormality?
Yeah, it can be present.
Okay. So how will you like to investigate this case?
Okay. First of all, I will have to. First of all, I will have to do some routine blood tests, including complete blood count, to see whether there is any neutrophilia anemia present or not, and also there is whether there is any thrombophilia present or not, thrombocytosis. And then I would like to do markers for inflammation like ESR and CRP. Afterwards, I would have to do serum electrolyte level, serum creatinine level, and also ECG, echocardiography, urine routine macroscopic examination, and chest X-ray PA view, and also the serum lipid profile. And then I would like to, I would want to do some specific tests. Okay, for this patient, I would like to do urinary vinyl melanic acid VMA level, and also I would like to do serum TSH level and T4 level, and I would also, if needed, I would also like to do genetic testing of the patient according to genetic counselor, and also I would like to measure serum parathyroid hormone level, serum vitamin B12, calcium, and phosphate level.
Did you mention urinary metanectin level?
Yeah, I told VMA level.
Is VMA and metanectin same? I don't know.
Yeah, I think now VMA level is measured more. I'm not sure whether it's metadefrin now or VMA level. I'm not sure.
Okay. Have you mentioned the genetic testing?
Yeah, I told that genetic testing is needed.
Okay. How will you manage this case?
First of all, I have to do patient education and counseling. Then I will have to form a multidisciplinary team, including medicine specialist, then cardiologist, uh, endocrinologist, and if needed, also occupational health therapist, if needed. And then I will have to go for some specific management. Okay, in this patient, usually surgery is needed in the long term, but before that, I think it's more important to give alpha blockage by giving a phenoxybenjamin. Okay, then if needed, I think then surgery can be done in this patient, and I think that's the treatment. And also, uh, after genetic testing, if it's found as Menn syndrome, then other treatments should be carried on. The problems to treat the other problems like hyperparathyroidism or any thyroid involvement, medullary carcinoma of thyroid, something like that.
Okay. In the history taking, you have missed a few things.
Okay.
That is,
Please
you
tell me.
haven't asked about the frequency, how frequently you are having this.
Didn't I ask? Oh, that then I forgot completely. Okay.
Okay. And during that episode, if there is any disease spell, if there is any history of loss of consciousness,
Mm.
and after this episode, if there is any other residual effect like any drowsiness, any weakness,
Yeah. Mm-hmm. Mm.
also you haven't asked about the past history well. There's a history
Yeah.
of thyroid
Mm.
operation, what type of operation was done, why it was done,
Mm-hmm.
and also you haven't asked about medication history when if there is any changes in the doses of thyroxine, if there was any other recent medication was added. Patient already said you that they gave some medication for anxiety.
Yeah. Yeah.
So you missed these points. Otherwise, everything was covered.
Okay. So what was the case actually? Pheochromocytoma, Men's syndrome?
Likely to be pheochromocytoma, but thyrotoxicosis cannot be overlooked.
Yes. Yes. Okay. Yes. Okay. So anything more? The treatment was correct, I think. What I told.
In the investigation, I think you haven't mentioned the serum calcitonin level,
Oh yeah, yeah, yeah.
thyroid
Serum calcitonin
profile.
level. Yeah, thyroid profile I told. TSH T4 T4 3 level. I told it, but I missed serum calcitonin.
Calcitonin, serum calcium level.
Yeah, I told the calcium, parathermal, vitamin D, and phosphate. These four.
Okay. Have you mentioned 24-hour ECG?
I told just ECG,
Okay,
not 24-hour.
24-hour ECG and echocardiogram.
Yeah, yeah. Okay.
And you went and also in the physical examination point, what would you search for?
First of all, I would like to tell the patient to bring out his hands like this, and then look for whether there is any tremor present or not. Then I would like to feel his pulse. Okay. Then after that, I would like to listen to his heart, whether there is any problem present or not. After that, I would like to have a look at the faces, uh, whether there is any sweating present or not. And then I have a look at his gland, okay, neck gland, whether there is any surgical scar mark present or not. However, the scar mark, then I would like to take him to tell him to take a sip of water and then drink when I drink it. Okay, and then feel whether there is any thyroid gland present now or not. And then I would also want to have a look at his tummy, that whether there is any scar mark present or not. And then I would like to feel his tummy to find out any tenderness present in the tummy region or not. And I think tenderness. And then I would also like to have uh, I would also like to listen to his lung bass and also check his leg edema. And I would like to complete the examination by doing the blood pressure level and doing fundoscopy, bedside ECG, and also urine for dipstick test.
Okay, have you mentioned neck lymph nodes?
Oh, sorry. I always miss this. This is my common mistake.
Plantar reflex?
Yes, plantar neck and neck. Yes.
Okay. Did you examine the heart?
Yeah, yeah.
Okay, fine, thank you.
Okay.